Hi, everybody. It's Jérémie Mercier live today on this 26th of January 2026. And we're going to start very soon with Professor Denis Rancourt, the 54th episode of Science with Conscience on demographic consequences of the COVID psyop. We'll start in a few seconds right after this little introduction. Okay, so it's not science en conscience, but science with conscience. So, hello, Denis. Salut, Denis.
Hello, Jérémie. It's a pleasure to be here with you again. I haven't done this in an interview with you since about 10 minutes ago when we did the whole
but
thing
it was
in
in French, so we're not talking the same audience now, right? So, for those of you who are French speakers, donc pour les Français, on vient de faire en français juste avant, mais là, ça va être en anglais. So we'll continue in English now for the English-speaking audience. So thank you again for being here with me today, same day. We just finished 20 minutes ago our first our episode in French, sorry. And we're going to talk today about the demographic consequences of the COVID psyop. It's a very big subject. We've been working on this together for more than 5 years now. You started on your own first, and I discovered your work first in May 2020 when you wrote that article, State of the Art, on face masks. Face masks. What was the? Sorry, face masks. Don't work. Sorry,
masks don't work. That's
right. Masks don't work. Just masks don't work. Right.
Yes.
And so I made an interview of you in French, which had a huge success and helped lots of people not wear this mask during the whole COVID era. And then we started working together from maybe June or July 2020 with Marine Baudin and Joseph Hickey later. And we worked a lot on all-cause mortality, an analysis of all-cause mortality, and especially because there has been a big change in what we observe in all-cause mortality during the COVID era. And I want to talk with you about these changes of all-cause mortality, and the link with vaccines and other measures that may have caused spikes in mortality. But first, can you just introduce yourself a little bit before we start talking together?
Okay, yeah. Okay. I'm Denis Rancourt, and I was a professor of physics, a full tenured professor of physics at the University of Ottawa. My career there was 23 years. Before that, I did the PhD in physics at the University of Toronto, and I did postdoctoral studies in France and also in the Netherlands at national laboratories. I've always been interdisciplinary, and I mean it in a very wide range of topics. I've been an invited speaker at international conferences in many different areas of science, including everything from environmental science, soil science, crystallography, biogeochemistry, and physics, and including magnetism, the study of magnetism, the study of nanoparticles, things like that. So I've published over 100 scientific articles in these various different areas. Some are quite well cited, some are quite present quite novel discoveries related to the environment. And I could go on about that for hours, but then I got interested during COVID in mortality studies, and also more broadly health questions and what causes disease and death and things like that. So for more than 5 years, in fact, even before then, in 2015, I had written a big review article about cancer and studied the medical aspects related to cancer and even developed my own kind of little theory about what cancer, at least the tumeric type of cancer, what you know, the neoplasm and so on, what really might be the cause, general features of it, and so on. So I've been interested in medicine and health for a long time. So when COVID hit, I immediately decided, well, the first thing I did, as you said, was everyone wanted us to wear masks. And I said, wait, is that demonstrated scientifically? So I went straight into the scientific literature, all the best papers I could find of comparative studies where you looked at, in a controlled environment, whether or not masks prevented transmission or had any benefit whatsoever. And what I found is that none of these controlled studies, the high quality studies, could even detect a benefit. And all they saw was negative effects such as headaches and things like that. So I wrote a review of the scientific articles of the highest quality right at the beginning of the pandemic. And I put it up on ResearchGate. And within a short time, it became very popular in social media and also with big nonprofit organizations such as Children's Health Defense in the United States. And it was talked about in many places, and I was interviewed about it several times. And ResearchGate said, we're taking it down. And I asked them why. And they said, well, it's being read too much. It's being read too much, and from sites that are not research institutions. So it's being read by all kinds of people too much. So we're taking it down. And eventually they even barred me from accessing and being a member of ResearchGate, where I had, you know, over 100 articles, and I had quite a profile at ResearchGate. They just took me out. So fine. That was my first COVID censorship. I've been censored before, but that was the first COVID.
What were you censored on before?
Oh, many things. I don't want to get there. I don't want to go there. But it was mainly in relation to political correctness. Let's put it that way.
All right. Yeah. Okay. Okay. Yeah. So you're not politically correct. But today we are kind of allowed to not be politically correct for a short time. I don't know how long it would last, but let's take advantage of that time period. So we're going to talk this afternoon for you in Canada, about all-cause mortality, and especially since the COVID era. What are the main features of all-cause mortality that you observed since March 2020?
Mm-hmm. Well, just a quick reminder that all-cause mortality is highly reliable national data collected in a serious way by nations. It's the best kind of data you can get to study large things that would cause mortality in the society. So that's the high quality, high time resolution, and often high spatial resolution data that we study. And what we saw right away, I immediately, when they started saying there's people dying and the emergency hospitals are full, I had a friend who was going around to emergency hospitals and seeing that they were empty and wouldn't be allowed in, and all the waiting rooms were empty, and there was no ambulances. There was the parking lots were empty. All the big hospitals in Ottawa were empty at the time where they were screaming that there was this horrible problem, we had to get ready for it, and so on. And she kept doing this friend of mine, and so she made videos showing this reality, and I put those videos up on YouTube, and those videos were banned, and I was warned that anything more like this and my channel would be closed. Okay.
Oh, they were banned in early 2020 then?
Yes, in 2020.
Okay. Before censorship really started, actually. So
that was, well, it was in 2020 when the hospitals were said to be, I don't know the exact dates, but anyway, I was happy to put her videos up on my channel. And YouTube just freaked out. You couldn't say those things. You couldn't show empty hospitals and empty parking lots and interview the staff at the entrance to ask whether or not the people had been in the hospital. You couldn't do that. And so that was not allowed. And so around that time, I decided, well, let's go straight to the data. Let's go straight to the national data. Let's look at all-cause mortality as a function of time since before the pandemic was announced. And let's see who has data. Let me find it. Let me let me make graphs and let me see what I see. And what I immediately saw was that in all the jurisdictions that I had access to at the time, which was most European countries, the United States and its different states, and Canada, but Canada was a bit late in the data, so there wasn't as much of it, and a few other places. All the data that I could see, there was absolutely no change in mortality, no excess mortality whatsoever until the pandemic was announced by the World Health Organization. Nothing before. Mm-hmm. And then as soon as that date, which I put on my graphs, I actually used a pencil at the time. I was graphing this stuff on paper, and I used a ruler and put a pencil at the date of the announcement. And immediately after, there were peaks in all-cause mortality, completely unusual peaks in all-cause mortality at a season in North America where, in the Northern Hemisphere, I mean, where you shouldn't have these peaks. So it was unusual, and these peaks did not occur everywhere. There were many jurisdictions that did not have these peaks whatsoever. Many states in the US most states in the US did not have anomalous mortality at all at that time. And some had very large peaks, like New York, for example, Northern Italy, and so on. Okay, so I saw these peaks, and I saw that they were synchronous, that they were happening at the same time, which is impossible in terms of the spread model of a viral respiratory disease, because you have to imagine that it starts somewhere and then it's taken around the world with airplanes and transportation means and person-to-person transmission. And if you work out those models, and that's been done since that time, but I knew it from my experience with these types of models and from looking at the tentative literature that existed, that this made no sense. And in fact, we proved that years later, we had high resolution data, and we proved that it was inconsistent with any of those models, no matter how you want to tweak them. Okay. So anyway, at the time, I just said, this is crazy. It makes no sense. It cannot be a pandemic. And it's happening at exactly the same time, these peaks where they occur, where in the hospitals and in places, they are doing very, very aggressive things, very aggressive responses. So I immediately announced in the title of my article, which came out on the 2nd of June of 2020. So I posted that very early as I could, with all the graphs and all my arguments and the references, and said, this is the state killing people. This is not a pandemic. This is institutional misbehavior causing death. And I forget what the exact title was, but it was along those lines.
Mass homicide, something like that.
Okay, mass homicide. Yeah, I talked about mass homicide. Okay, so when I wrote the title, I said to myself, maybe I'm going a little too strong with the language, but in hindsight, it was exactly the right thing to say, And that came out on the 2nd of June, 2020. I think I was the first in a serious scientific report to show these peaks, their properties, their nature, how they were synchronous, and to interpret them as not being due to a pandemic, but being due to the measures. I was the first to do that. Mm-hmm. And then that launched me into this area of interest, and I came into contact with you and another scientist that you're in contact with, Marine Baudet, and I was already collaborating with Joseph Hickey. So we decided we would just do more and get better data and continue following the data through the pandemic, because vaccination was just around the corner, so we wanted to see what would happen. So then we together, and myself and with different people, I've been involved in more than 30 serious large reports about all-cause mortality in the COVID period, and very detailed things, and often very insightful interpretations and hypotheses and discoveries, I would say. So it's a very large body of work that has been used as evidence in various venues that I've used it as evidence. So that's what we've been doing. So it's important to say
I wanted just to remind something. So we're talking about all-cause mortality, which has no bias whatsoever, as opposed to COVID mortality, which is biased per se.
Yeah, there's no diagnostic bias. There's no bias in deciding the cause of death. It's a death, period. So you don't entertain these ideas about how you're going to decide what the person died of. And so there's very low risk of any bias whatsoever. The only errors that occur sometimes is the person will die and the death won't be recorded until after a holiday or something, this kind of thing. And those artifacts are easy to spot because it's obvious what's going on. And it's only certain jurisdictions that have those artifacts. The UK is notorious for that. And but there are known artifacts like that which are easy to correct or easy to recognize at the very least. And so it's really very good data. And now in the modern data, it's high resolution spatially, and also it can go down to days, day by day, what that mortality is. So we analyze it in great detail, and I want to give you the listeners an overview of what we saw around the world when we look at this mortality data over many years since the COVID pandemic was announced. So as I said, nowhere could we find death prior to the announcement of the pandemic. So the virus decided not to be lethal or to cause any deaths until it was told that it could do so by the World Health Organization. Okay, that's the first
permission
thing.
accept.
Yeah. And so then the second thing is this peak that happened at the beginning. Some people said it was a little earlier in northern Italy and so on. Yeah, it was a little earlier, but not much. It's right there, it's right there at the same time. So we looked at this in great detail in the years that followed. And but it's important to say the following things. First of all, there was in certain jurisdictions huge excess mortality before any vaccination occurred. Okay, so there are some countries where the excess mortality before vaccination is greater than the year after vaccination started, much greater. That is one scenario. There are other scenarios where there's virtually never any excess mortality until when you start rolling out the vaccines. There are many, many countries like that, and we studied almost 150 countries. So we found a whole bunch that were in that category. And then we saw also that, let's say before vaccination, mortality, large excess mortality versus no excess mortality can happen in countries that were side by side and that had huge economic exchanges during the whole time. So we saw borders in Europe that separated all the countries surrounding Germany and Germany itself, which did not have that large essential peak at the beginning. And they did not do those aggressive treatments. So it's easy to understand. So the virus was waiting and listening for directives from the World Health Organization, and it also had a passport. It was aware of where it could and could not go. Okay, and so that's before vaccination started. Then after vaccination started, you could have a lot of mortality that was in relation, that appeared to be chronologically correlated with the vaccination rollouts. And this was especially true with the booster doses. The first booster and the second booster, each of those doses were rolled out very quickly. They went in and got all the fragile people in institutions and hospitals and care homes, and they vaccinated them in the whole country at the same time and very rapidly. Within weeks, it was over. Okay, that's how they were rolling out the boosters, because they had a schedule in mind, and they were all given a first dose, and now let's all at the same time give them the booster and so on. And so when those boosters were rolled out, they were often associated with sharp coincident peaks in excess all-cause mortality. It was stunning. It was striking. And so we first saw this really strikingly in the data for Australia and the big regions of Australia. Each of the regions of Australia and Australia as a whole, the first booster dose that was given quickly coincided perfectly with this huge peak in excess mortality in a season in Australia where there's normally no seasonal peak there whatsoever. So it was very stunning. And that's what got us thinking that the vaccine itself could be toxic toxic to the point of detecting a large peak in excess all-cause mortality.
Mm-hmm.
And so we launched into that. We tried to find more countries where this was happening, and we found a whole bunch of countries that the rapid booster doses were giving sharp peaks in excess mortality. So we calculated how many injections were given in those rollouts and how many deaths were in those peaks. And we calculated a vaccine toxicity from that. And then we extrapolated what would be the mortality in the world given the number of vaccine doses that have been given. And that's how we came up with this 17 million number of total vaccine deaths for the world. And that number has been repeated everywhere and so on. Now, given what we know now, we have to retract this. There is a strong temporal association. Epidemiologically, you could say there's a proof that the vaccines are associated with these deaths, but it is not a causal relationship directly due to the toxicity of the vaccines. And we discovered this by using very strong data. The kind of data that would allow you to resolve this is when you measure all-cause mortality and you know the vaccination status of the person who died. So there are several jurisdictions in the world where they're measuring all-cause mortality as they normally do, where you know the age of the person, you know where in the country they died and so on. But in addition, for each person that died, they knew the COVID vaccination status, which doses had been given to them before they died. And so none of this bias related to waiting until they're considered immunized. No, you know that they were either injected or they weren't, okay? And so that kind of data, and there have been about a dozen articles that have been written using that kind of data so far. And I have looked at them all, and I can tell you that it's very hard to see a difference between the two categories of people, whether they're vaccinated or not. There are peaks in mortality happening at the same time in both groups, and the small differences between them can easily be due to healthy vaccinee bias, for example, where you don't vaccinate the most sickly people or the people that are near the edge because this challenge of the vaccine, which contains toxic cationic nanoparticles, might kill them or might harm them disproportionately. So they don't vaccinate those people. And that's one of several biases that exists in whether or not a person who died would have been vaccinated or not. So these biases are enough to explain the small differences that are seen, and the differences are nowhere near the large toxicity that we had calculated. So we have to reset our thinking and say, okay, we have a strong temporal association. We have peaks at the same time that the peaks of mortality at the same time that there's rollouts. What the heck is going on if it's not the toxicity of the vaccine that's killing these people? Okay, if these peaks are actually happening with unvaccinated people as well, okay, the same peaks, large peaks like this are happening as you roll out in the people that are unvaccinated. I mean, what the heck? So we had to rethink, and what we ended up coming up with, the hypothesis is that the act of these sudden rollouts is a huge aggression against the populations in these institutions, fragile people in these institutions. So whether you end up getting vaccinated or not, the fact that they're rolling in military style and doing this campaign and disrupting everything, your feeding schedule, your hydration schedule, your medication schedule, your visitation schedule, you have to stay in your bed and so on. The fact of this disruption is putting on enormous stress that could kill people. That was our first hypothesis. And then we noticed by looking at more data that at the same time that they were rolling out these booster doses, they were also rolling out a massive increase in testing. So they're also testing at the same time in the same institutions with fragile people. And if you had a positive test, there were very significant measures that were being imposed on you in terms of being treated, isolated, you name it, immobilized. All of these things are the kinds of things that cause large biological stress on an individual. And if you're old and fragile, that's enough to kill you.
Mm-hmm.
And so that's our hypothesis now of what's going on. And we were able to confirm this by various measurements. So, for example, well, one thing I did right away was to review the literature on biological stress. And can it really kill people that quickly and that effectively? And there's no doubt that it can. One of the main mechanisms is transmissionless pneumonia. So what's traditionally called aspiration pneumonia, that when you are stressed biologically, you're more likely to get it. And that pneumonia can be fatal within days in a fragile person. Okay, so it's very dramatic, and it has nothing to do with transmission. It's known. It's a known pneumonia that does not rely on transmission. It's a bacterial pneumonia that is from your own microbiomes in your body, in your respiratory tract, and so on. So I wrote an article about that.
What happens following a biological stress?
Yes. Mm-hmm. There's an increased risk of you getting this kind of pneumonia. So I wrote an article about that, reviewed all the literature and so on. So there's a lot of literature that shows unambiguously that social isolation, immobilization, physiological stress like feeding and so on, changing your medication schedule, all these can cause very significant biological stress, enough to kill a fragile person. Okay, so we know from the knowledge that that's true. Now, in addition to that, we have found one or two jurisdictions where the peak in mortality is before the rollout of the vaccine, the booster dose of the vaccine. Okay, so that contradicts this idea quite a lot. You have to start making suppositions like, well, okay, but they started vaccinating a little before, and they would have hit the most vulnerable at that time at the very beginning. You have to start trying to understand it in that way. Okay, why is it happening here but not elsewhere, and so on. So, but we found that in one of those jurisdictions where it was really clear, I think it was the Netherlands, we found that there was death occurring before you rolled out, but it was occurring at the same time that you rolled out a heavy testing schedule. So you could see that the number of tests being administered in a very sharp peak that was happening before you rolled out the booster dose, and that coincided with this large peak of death. So again, a big campaign of testing like that is going to totally disrupt people and so on. It's possible that most booster doses are always accompanied with testing. And it's possible that it's the testing disruption, maybe, because you isolate people when they get a positive test. Those might have been the people that died. And they would have died of COVID since it was positive, right? So that's how we're understanding it now. So all of this to say that our estimate of global deaths from the vaccine of 17 million is incorrect. That is too large a magnitude. Now, that doesn't mean that the vaccine is not toxic. The vaccine is proven to cause death. There are many studies involving autopsies, surveillance data, clinical reports. There's all kinds of case studies that show that the person definitely died as a result of the vaccination. So there's no doubt that the vaccines are toxic, but not
to the extent
in the magnitude that would cause this huge peak in all-cause mortality. That's the conclusion that we have to come to.
It's more like the whole package that created this excess of mortality, which is the vaccine, the testing, the isolation, the societal aggression on people, including the vaccines.
Yes, the whole package of things that independently are all able to cause significant biological stress. Because biological stress is deadly. Psychological stress even is deadly. in terms of, and the reason they would have died of a respiratory condition is because of this transmissionless pneumonia that I talked about, and the literature for which I have reviewed. You see, there's a little mini revolution in medicine these days in relation to pneumonia, because scientists are realizing and admitting and studying the fact that you can get pneumonia and die, or even just get pneumonia and recover without there being any transmission. You don't need transmission because you have a complex microbiome both in your gut and in your respiratory tract. And sometimes the gut microbiome, by regurgitation, can go into the respiratory tract. And so there's enough there in terms of potentially destabilizing bacteria and other microorganisms that can give you pneumonia very, very quickly if you are more likely to have these problems, or if you're more highly stressed, and you can die from it. So this is now well known. So it doesn't matter how much you mask, how much you filter the room, the air in the room, how much you do any of these things, how much you vaccinate, people are going to die of pneumonia if you aggress them in all these various ways. Okay. Yeah. So that explains the relationship between respiratory problems and the all-cause mortality, which is often highly correlated. Not always, though.
And how about that study that made you think that maybe the vaccines were extremely toxic? I mean, this study you made about spikes of mortality in India in 2020.
Oh, yes, in India. Well, India was one of the first jurisdictions I looked at because it was so stunning. India is a case where you have absolutely no excess mortality for the first year in 2020, and continued no excess mortality in the first several months of 2021. But India didn't roll out the vaccine until several months into 2021. Problem of access to the vaccine. Then when they did roll it out, they rolled it out very aggressively. The president or the prime minister of India said, that's it, now we have to vaccinate everyone right away, protect the most elderly, the most sick. Here's a list of all the sicknesses, go and vaccinate those people right away. I mean, it was crazy. It was really imposed, and they were forced vaccinating people. And at the time of that rollout, there was a huge increase in mortality. More than 1 million people, I think 2.8 million people in India died directly when they rolled out that vaccine. So that makes me think that given the health status of the Indian citizens that were vaccinated at that time and so aggressively, that it could be related to toxicity, could also be related to the stress. But that was a stunning case, because nothing until you do that, right? Until you go into all of the neighborhoods and everything, and you just start, and the prime minister was calling on everyone to participate in holding people down while we vaccinate them, basically. And there are videos of this. I mean, it was very aggressive. So that was associated with a huge excess mortality. That some of the researchers said, oh, that's the Delta variant. One researcher out of 3 said that. And I showed that was a very tenuous and improbable hypothesis in the paper that I wrote about India. It was just silly. There was nothing. There was no reason to conclude that at the time.
Okay.
In the specific cities that they were studying. So there you go. That was India. So then after Australia, where we saw that sharp coincidence, we found, I think, 15 or more countries where there was this very sharp coincidence in time between the rollouts of a booster, and the first booster and the second booster, and sometimes a third booster. And each time there was this peak in mortality. So there was an epidemiological proof that it was associated with the vaccine. It can't be a coincidence, but it wasn't directly causal. Yeah,
it's more likely caused by the package, including the vaccine. Then
yeah, but you can leave out the including the vaccine part, because that would have been the actual toxicity of the vaccine would have been a very small part of the total mortality peak.
What would be the percentage, if we could say?
That's an ongoing research to estimate that, because it's really difficult to estimate. It's easy to show that the vaccine kills in case studies, in certain clinical studies, by autopsies, when you know when the person was vaccinated. You can do that, but these are like small samples, right? And then you can do vigilance data where people report that someone died after being vaccinated. So if you use that as kind of a record, then it's probably 30 times less than the peaks that we were seeing.
Mm-hmm.
Okay? And then people would say, oh yeah, but that's an underestimate. Well, this is in jurisdictions where you were required by law to report a death, no matter what the cause was, if it happened after vaccination. Within a year after vaccination, you had to report it in the system. So yeah, it could be underestimated, but let's say it's underestimated by a factor of 2.
It's still an order.
It's still
okay.
An order of magnitude. Yeah.
Mm-hmm.
So
right. Okay. And so what we can say, though, is that the societal aggression on people is killing a lot. The lockdowns, the mandates, whatever the mandates are, stay at home, or put a mask on, or do the test if you want to access, I don't know, cultural places or whatever, or even just be allowed to eat with the other people if you are in a pension home, maybe. So yeah, so this kills people.
Yes, that's one of the biggest discoveries and convictions that I've developed as a researcher, is that biological and psychological stress is an incredible killer. It's very effective, and there's many ways to induce it, and it's very important. And this aligns with bigger principles. In particular, any society, animal society, human society, will always organize itself, if they're social animals, into a dominance hierarchy. And the dominance hierarchy stabilizes itself by dominance hierarchy aggression to the underlings all the way down the chain. And that aggression, it induces, it's random, it's irrational, it's just to keep you in your place. And that induces a stress that makes you unhealthy. You don't live as long, and you're sick more often. And so there's always a gradient of health in any dominance hierarchy. You can't avoid it. It's structural. And I have argued that there's an evolutionary selection of sensitivity to stress of your metabolism, because that stabilizes the dominance hierarchy, which has a big evolutionary advantage. Okay, that's how I made that specifically in a paper. I argued that. So anyway, there's always this gradient of health. And if you want to know how healthy on average someone's going to be and how long they're going to live, just look at their social status. That's the very first thing. And there's always this gradient. Now, in addition to that, there's a gradient, therefore, that aggression involves limiting access to resources, food, but also the quality of the food. Even in animal societies, the nutritional value of the food you get to eat is less than what the dominants eat first, right? They go for the richest organs and this kind of thing when they eat. So there's always also a nutrient deficiency in the underlings within a dominance hierarchy, and that's going to be such that the stress will even be more powerful at killing you and be more effective at causing you harm, and therefore it'll be more effective as maintaining this dominance hierarchy. Okay, so all of this is the biggest factor that determines your individual health. So it's natural in an upheaval like this contrived pandemic that the increased stress could be a real killer, because that's in general in a population the main killer. Okay, that's one way to see it. And so you can put it all together like that. And it's unambiguous in the scientific literature that stress kills, and all kinds of different stress, even just social isolation. I mean, there are studies from Professor Sheldon Cohen in the US, who showed that respiratory conditions arise in university or college students when they're more socially isolated versus not. So they're socially isolated. In other words, they're in less contact, but they get more sick. Okay. From respiratory conditions. So all this is really, really well documented scientifically. So yeah, it's the stress, stupid. It's the aggression of the system against you. And so it's the biological stress, which includes, intubing you and confining you and all these things. Those are real killers. Now, in addition to that, stress is less likely to kill a young person than an old person. Your biological susceptibility to being harmed by stress is higher as you get older, exponentially higher. But the young people, what we were surprised to see in the mortality studies is that younger ages and young people, including adolescents and young people and so on, when they announced the pandemic, there was a stepwise increase in the mortality. And it stayed there. So young people don't have seasonal variations in the Northern Hemisphere, but it's normally flat, but there was a stepwise increase and then it stayed there. And it is part of the persistent mortality, even 5 years down the road. Okay. So what's going on there? Well, what we were able to show and demonstrate in the case of Canada, and we've seen this in other jurisdictions as well, the US and so on, is that there was a large increase in opioid use among young people. And there was a large increase in opioid related diagnosed as related to opioids as well. So that increase in all-cause mortality is largely due to opioid overdoses, accidental overdoses of young people using opioids much more heavily than before. Now, when that happens in a society, opioids are very addictive, and addictions don't just go away. You're basically struggling against that kind of addiction the rest of your life. So that means you maintain a population of addicted people who are always at a high risk of accidentally having an overdose, which keeps that plateau of high mortality there. And so that's where a lot of the persistent mortality is from after COVID. The COVID campaign has wound down and everything. Jurisdictions like Canada have a persistent mortality like that. So that's another thing that we discovered. So there are many things going on there.
Is it possible to say that the COVID psyop was aimed at killing the most fragile people of the society? Can it be seen this way?
Well, the dominance hierarchy already is doing that regularly.
Yeah.
The entire medical system is an institution whose real purpose, in effect, is to maintain the dominance hierarchy, is to keep you dependent, ignorant, thankful to have a boss or a state that will provide healthcare and so on. The whole purpose of the medical apparatus is to maintain this dominance hierarchy. From an institutional analysis, that's what I would say. And the same is true of education and other big institutions. So you're already doing that. You're already killing people and getting rid of them as much as you can. I personally don't think that the COVID campaign was intended to reduce the population of the most fragile. I think that's just something that accompanied it. But I think it was mainly intended as a military rollout that was planned and executed. And the purpose, the motivation was not to change the structure of the age pyramid in the country or anything like that. I think the purpose was to demonstrate that the military could inject everyone, that the propaganda worked well, that all the institutions and everyone cooperated, and you could just inject everyone, and you can convince most countries that they should be injecting as well. And I think it was a demonstration of that. And because, for decades now, the U.S. vaccination is an integral part of U.S. bioweapons preparation, if you like, or readiness. That's what they call it. And so I think it was part of that. I think it's part of developing a weapon. And the weapon is being able to inject people whenever you want and demonstrating that you can do it and how you could do it. I think that's what it was. And also, it justifies, to have a pandemic that you save people from, justifies that you can spend all this money and keep developing this weapons program involving vaccines. And you think deadly pathogens by gain of function and so on. Whether it's true or not, whether the technology actually works or not, is completely secondary, because it feeds huge institutions, careers, investors. It feeds all of this system. So it's going to have a life of its own, whether the technology actually works or not. So I think that this was not if you want to kill the elderly, you can do that. You can convince people through, what's it called? Help to die or whatever.
Yeah.
AIDS, is it? Or aide à mourir in French.
Euthanasie, yeah.
Euthanasia as a humanistic, wonderful thing that we can do for you. It's easy to make propaganda that gets people to accept that, and to make it part of your society, if that's what you want to do, if that's what you think you can get away with politically and so on, then that's easy to do. You don't need to fake a pandemic to do that.
Yeah, and you've had euthanasia for a while in Canada, right?
Oh yeah,
and it's working well.
Yes, and it's always been an option in most big hospitals in most advanced countries. You could have auto-delivered painkillers in any amount that you wanted. So the person basically in those circumstances would decide when they've had enough, so that it's not like it's completely new. What's new is legalizing it and the propaganda around it and so on. But I think that's definitely a societal design campaign in terms of age structure adjustment. But I don't think that the COVID pandemic itself was.
And I wanted you to talk about the impact of COVID and COVID vaccines, or COVID vaccine campaigns in particular, on pregnant women and children to be born.
Right. So we've started studying that because we noticed by looking at the data for the United States that there are two large peaks of excess mortality in women associated to their birth giving and to the immediate period that followed. They die during that period, during that process. Okay, so these perinatal deaths of women have two peaks that occur just after the CDC insisted that now we've decided that the COVID vaccine is not only safe, but you'll be putting your infant at risk if you don't get it. And there was a big media and enforcement campaign, and all the institutions went along with it in the US. There was a date where that occurred. And after that date, there were these two peaks in that mortality. So I was shocked to see that coincidence. And so we started looking into this. And what we found was that the first peak corresponds to just after when they would have started vaccinating the women that hadn't been vaccinated until then. And the second peak would have been when they rolled out the booster, okay, to those women. And so this is striking. But what we looked at it more deeply, because we didn't want to be fooled to think that this was due to vaccine toxicity. And so when we looked at it more, we found that in young people of the same age as women who have infants, that is between 15 and 44, they also have two peaks right there. So if you look at their all-cause mortality now, not but from diagnoses, but all-cause mortality, they have no seasonal dependence at that age. That's normal. And then they have those two peaks. In addition to, remember I said there was a stepwise increase for young people, and it's up there. And then on that plateau, there's two extra peaks right there when the women are dying in relation to childbirth. So he said, holy geez, it's young people of that age, and it's men and women, not just women, and it's not just pregnant women. So now we're in the process of calculating the risk of dying in that period where there are those two peaks, if you're a pregnant woman, if you're a woman, and if you're a man. So we're in the middle of doing those calculations. But for now, what we also saw was that when they would have started vaccinating the women, if those women were being vaccinated in their first trimester at the beginning of their pregnancy, which is the time where a chemical accident or ingestion can have the biggest effect on the pregnancy, 9 months later, there would be more deaths of newborns. And what we find is 9 months later after that, there is indeed a peak, an increase in the deaths of newborns. Okay, and so we're quantifying the risk of that. So, and we're normalizing it by the number of live births, so we can really calculate a risk per birth that if your parent, mother, was vaccinated at the beginning in the first trimester, that you have a chance of dying. So we're trying to look at all that together, and we're trying to be very careful not to assume causality, even though we have strong correlations.
Yep.
And so we're verifying it by every possible data that we can find.
Okay. And now, if COVID was not intended at reducing population, what was the aim of this psyop? Why did they do that? And if we take some insights, what is it part of? What does it? What was before? Why they did it, and what's coming after COVID?
Yeah.
And will they do, for instance, another fake pandemic in the future? Now they know that they can have a lot of vaccinations delivered to people everywhere in the world.
Yeah. You have to know that the context is one where vaccination is a huge military campaign and has been for decades. It's the reason that we have flu vaccines, is to maintain industrial preparedness to be able to produce vaccines and to pay for it, to get it accepted by the public in the US so that they don't object when they see the Senate discussing these incredible costs in relation to those campaigns. And so it is a military campaign, and many pandemics have been rolled out top down in the past. But this is the first time that it was done in such an aggressive way that it really caused a noticeable all-cause mortality peaks and increases. But it was a military campaign. This is extremely well documented. The military paid for the manufacturing of the vaccines, primarily in the Western countries, and used the name of pharma to legitimize what they were doing. And this is all has been exposed and documented and written about. There are books and books and references and documents that have been disclosed at Senate and so on. So it's not a secret that this was a planned, coordinated military campaign of the USA, and it's all the satellites that it controls and all the vassal states that it controls, including Canada and Europe and everywhere, Australia, New Zealand, and so on. And Russia and China developed their own vaccines because they did not want to be blamed for deaths in the world because they didn't vaccinate their own populations. They had all their own domestic and geopolitical reasons for going along with it and developing vaccines and doing similar things in their nations. But it was, I do not believe that there are overlords that control both the USA and the Western, connections, and China and Russia. I really believe that geopolitics is real, that there is that China has sovereignty, that Russia has sovereignty, and that they did these things for reasons related to propaganda and domestic reasons in the context of the huge propaganda around this global pandemic.
Mm-hmm.
Yeah.
And so we talked earlier in the French broadcast about how you did this work on what happened at the end of USSR and the emergence of new topics, global topics like climate change, like gender equity, like anti-racism and stuff like that. And COVID is part of that, you say. Can you explain?
Well, COVID is part of it. It's part of it in the sense that it was to illustrate the importance of geopolitics, and COVID has occurred within this geopolitical context. It was a U.S. project. The geopolitics and the connections and the penetration of Western propaganda into China and the USSR explains how they also responded. But in terms of the world and our lives are going to be mostly affected by geopolitical events, dynamics, forces. Okay. And I illustrated that by talking about an article I wrote in 2019 in which I explained what happened after the dissolution of the Soviet Union. And what happened was, one of the things that happened was that they did international conferences right away on new concerns, which became new Western ideologies. So gender equity, anti-racism, and environment and global warming type things. And these were injected top down into all our institutions, the universities, everything. And I do the history of that, and I show it, and I show how it has evolved. And I explain that this was to create generic ideologies that would optimize the ability of the West, led by the US, through globalization to exploit as many people as they could easily without being interfered with through national ideologies or national religions or different cultures and so on. They wanted everyone to agree that globalization was a wonderful thing and it was the only way to save the planet and to save us from terrible racism and so on, right? And to give us the most equity. So they wanted to globalize the world with these generic ideologies. And they were quite explicit in a lot of this is quite explicit in government documents and so on. So I wrote a big article about that to explain it. But then recently I wrote another article to explain that we're now at a turning point. This is being demolished under the Trump administration because the US has now decided that globalization no longer serves its interest. That globalization, in fact, is harming its interests. It's limiting its ability to do war campaigns and to fight in the context of industrial and economic powers that are rising and that are becoming competitors to the US. And so it has decided to dismantle these things. And so the United States has withdrawn from 66 international treaties of this type, including the 1992 or 94 convention about environmental promises. And it was a treaty and they withdrew from it. So they are now mean-mouthing everything related to climate change and so on. So I do the review of that in my most recent article. So this is all to illustrate that a lot of things can be imposed on us through propaganda that are to manipulate us. And that things are changing now because of geopolitics. And these are big changes and big forces, and that's what's going to determine our lives. So I don't know if I think they will give up this pandemics. We've been through several of them now that were planned and executed. I think now that the US has withdrawn from the World Health Organization, has said we don't want the globalists, that's not what we're about. We don't want, and that they are being very critical of vaccines through the Make America Healthy Again, or I think that there's a good chance that they're not going to try this again. Okay. Now, there might be a group that will try it. The globalists of middle power nations that Carney wants to create, they might want to have a pandemic. I don't know. Who knows, right? You can't predict these things. But I think that overall, a lot of this nonsense is killed in the same way that wokeness is being killed by the US right now, and that climate change is being killed by the US. A lot of this nonsense that affected us and that we found quite ridiculous is dead because of geopolitics. The US needs to get its act in gear. It needs to have an efficient military. It needs to be more focused in its efforts, and that's how it sees itself. And I think these changes are aligned with that.
But there are new, I guess, subjects that are going to be brought in to control us, right? So if they give up on climate change, gender equity, anti-racism, and COVID and vaccines, what will they try to keep us?
The US doesn't want to control you in Europe anymore. They just want to exploit Europe. Okay, they want Europe to be a diminish its wealth, diminish its industrial capacity, and they want to suck it dry. They want to they don't care about influencing you with ideologies anymore. They're really changing their focus now. Okay. So I'm sure that Europeans might, in trying to, if they ever wake up and try to throw out these puppets of the USA and decide to try to have some sovereignty, they might then want to invent or support certain ideologies. I don't know, but you'll see. But what's going to change our lives in Canada and Europe more than anything are these geopolitical battles. And boy, I'm telling you, we're going to be going through some rough times. No doubt about it.
So what kind of geopolitical battles do you foresee?
Well, you can see them already. There's a huge war, a kinetic war in Ukraine right now that involves the full power of NATO and the US against the full industrial and military power of Russia. I mean, it's a very significant war. And there is going to be another flashpoint around Taiwan because the US would like to use Taiwan and Japan in the same way that it used Ukraine against Russia. It would like to use Japan and Taiwan against China. So there's going to be some very tense and probably military conflicts there. These are huge because they reorganize entire economies, and they reorganize the focus of entire cultures and peoples and publics, and create all kinds of tensions that different powers try to exploit and so on. I mean, it's huge. So those are the kinds of conflicts that we're already involved in, and that they've been planning for decades. And this is what they've decided to do. So that's where we're going.
How about Greenland?
Greenland is another example. Yes. And Greenland is a good indicator of where the US wants to go and what it wants to do.
Okay.
Yeah.
Well, okay. Well, okay. Any other? So according to you, we may not see another fake pandemic coming in the next few years.
There'll be echoes of it. These are big administrations. They have habits. They have protocols. They have entire networks of pandemic preparedness. They feed pharma, and pharma funds them. So there might be all kinds of things, but it will not have the kind of overall impact of the last one, which was a very serious military campaign run by the US.
I'm asking the question because in France, they increased the number of compulsory vaccines for kids to 12 only last year. Last January last year. So now there are 12 compulsory vaccines for kids. and they are talking about introducing mandates for vaccines in Switzerland, where there was no obligation for vaccines as well. So it shows some tendency, I feel.
Yeah, well, that could be part of the U.S. exploiting Europe again.
Yeah, sure.
These are U.S. pharma companies, and it could also be part of those states imposing themselves within this dominance hierarchy. So one can understand from a big picture point of view all the reasons why that might happen, but there are probably big forces like this that are determining these factors. Will people fight back? I think that people in Europe and Canada will not fight back until they are very severely affected economically and in their everyday lives. That's when they will say, how do we push back against this? But as long as they're just making decisions about the wonderful medical programs that are going to save your child's life and are influenced by propaganda and are not directly being physically assaulted and have their resources reduced and everything, until that happens, they're probably not going to react. I had hope for the French during the yellow vest period. I thought, wow, these guys are wild. And but then when I saw the French reaction to the pandemic, which was a complete garbage, fictitious nonsense thing, and that nobody could see through it, and they were fighting each other to make sure that all these measures would be enforced. When I saw that, I thought, okay, even in France, there is no chance until you start really affecting people's livelihoods. No
French people were very compliant during COVID.
That's what I'm saying.
They did stay at home. Yeah, that's
what I'm saying. It's incredible.
Even the yellow vest, indeed. And one last question, maybe. So, do you think there's going to be something like a third world war soon, or maybe are we in the middle of it?
Well, we're already involved in a major war. Even a world war did not affect every country on the planet. Many peoples were not destroyed. The United States was not destroyed by the so-called World War. It was not a world war. It was a war that the U.S. sent resources and equipment to, so you guys can go and fight it out over there, and hopefully you'll defeat Russia. I mean, we call it a world war, but you have to remember that in Canada we were barely affected. We have memories of it because of resources being a little less and that kind of thing, but everyone just adjusted. So we're already in that kind of a war. This is a massive war in Ukraine, massive. You approach the same number of bombs and the same number of deaths as in the Second World War. So we're already in a pretty serious warring situation.
Okay. Well, okay. I'm not sure if it's a good way to finish this.
Maybe you're asking me, will there be a nuclear war with exchanges of nuclear missiles between the U.S. and China? That's another question.
Sure. Yeah.
Yeah, I think it's not even possible at this stage in history to predict if that's going to happen. You wouldn't have much. There isn't enough that has happened yet that you can say, okay, now we're on the verge of that. We're not on the verge of that, but it's entirely remains a possibility. I believe, for example, that there is a high probability, depending on how the war that they want to make in Iran goes, that they may use nuclear weapons against Iran. So if they attack and Iran responds with the full force of everything it has, they may consider it to be too much and use nuclear weapons against Iran. And then that changes so many things in the world you wouldn't believe, right? That's just that becomes a really huge conflict. How do Russia and China respond to that? And what posture do they take moving forward? So these things can happen in the coming weeks, basically.
Yeah.
So that's where we're at.
And maybe a last question, because I had this feeling, but I may be wrong, that COVID the psyop, the whole thing, was a preparation for a war and a test of submission, how submissive are the populations. And they showed, at least in the Western world, that they were very submissive. And since then, in France at least, they are reintroducing a military service, which is optional now, but will probably become compulsory in the next few years. So can COVID be seen as a preparation before
Yes,
war?
I mean, clearly the COVID episode or campaign, just like the behavior of the entire medical establishment, is about dominance hierarchy. And it is about training you, and it is about pushing you to be obedient, to know your place, and testing you at the same time. So it's part of that big overall thing. When you want to make war, you have to know that your population is going to go along, or is not going to. You have to know that you starting a war will not incite a civil war within your own country, right? That almost happened in Canada. The Quebecers didn't want to participate in the war, and they created a lot of internal national tensions. Okay, so you want to make sure that you can go to war, that the population will be behind you, and so you want to groom them in preparation for a war. And yeah, it makes sense that it would be part of that, whether it's conscious or not. I don't know, but it makes sense.
And maybe one really last question, because apparently this the way we're talking about things is not giving lots of hope to to some of our audience. But how can you yourself resist to this and not be like totally under whatever's coming?
Well, hope is a useless kind of reaction. It's naive. I don't like to think that I'm hopeful. I'm not hopeful in the sense that the world will become better, or that we will see better times. I think it's useless to have that kind of hope. I think it's better to have determination that you're going to try and have the most influence that you can to make the world more sane and more just. So I have a lot of determination, but I don't have hope in the sense of dreaming that it will be better, or dreaming of the possibility that if we can only get through this, it'll be better. I find that a useless waste of my mental, presence. I think more in terms of what can I do right now, today, with Jérémie on this station, to try to do my bit, to try to push things in the right direction.
Okay. Right. So it's a matter of posture.
Yeah,
you do what you feel is good.
Yeah, personally, I don't go with the hope thing.
Okay.
Maybe sorry to say that to your.
No, I totally get it. I understand what your point.
Yeah.
Okay. So
I respect people who have hope. I don't disrespect people who have hope. Mm-hmm. I'm not going to create a new religion and start, the hopeless people.
Hopeless with Denis. Okay, right. Okay, so I want to remind people that your work can be found here, and I will post it in the comment section as well. And thank you very much, Denis, for sharing your thoughts about all-cause mortality during COVID, what it means, and the future.
My pleasure.
Thank you very much, everybody, and see you next time for another broadcast in English in a few months, probably. Bye. Thank you.